Hi, and welcome to abdomen imaging. All right, here's a good example of an abdomen. A patient for a KUB is usually laying down on the table. We can see the IR down here in the bucky, and we can even see the marker placed here. This is a good spot to place your marker here on the right bottom corner of the IR. This is a right marker. And we can see that when the IR is pushed in, this side of the IR will be here on the right side of the body, thus the right marker. Then we also put it lower to be kind of out of the abdominal organs, out of the way of any abdominal organs that might be around. But to start off with, anyway, we're going to do our introduction. We're going to make sure that everything is removed. Even a bra that might seem like it might sit higher than the light field, still go ahead and take bras off. Even pants and underwear, sometimes they might have rhinestones on them, sparkly things, designs, whatever. It's usually a best practice to take underwear off as well, or ask patients to take everything off and put a gown on. All right, so KUB is supine AP or dorsal recumbent. That's another way of dorsal recumbent here is another way of saying supine AP. And the AP, of course, is our projection, and this is a body position. This is on page 114. We're using a 14 by 17 again, a large IR, and it is in the bucky. Our SID is 44 inches, but a minimum of 40 must be used. So 40, 44, either one is going to be okay. This increase of 4 inches from 40 inches, this little 44-inch SID, if that distance is increased to 44, the divergent X-ray beam gets a little more space to cover, can cover more of the abdomen if you take it a little bit further away there. Do not shield in these cases of the abdomen. Research over time has found that shielding even the reproductive organs, say for males, even that can increase the X-ray exposure to the body. So we just do not shield on anything in the abdomen. And this will include things like the L-spine, for example. Okay, so make sure the patient is straight on the table. You want them in line with the IR. The IR itself is straight up and down with the table, so ideally we'd also have the patient in the same position. Arms down by the side, away from the body. If for some reason the patient puts their arm, just like hands clasped over their abdomen, as they might be comfortable doing, that is a repeat if we have arms in front of the abdominal organs. Okay, now that vertical line, that kind of straight line up and down, will be mid-sagittal, so in the center of the body. Our other line will be at the level of the iliac crest. So you're going to have to palpate and feel for the iliac crest, and then place that horizontal line. Let me show you this one here, this horizontal line here. You're going to place it at the level of the iliac crest. This one here, straight up and down here. Previously, our vertical line on the chest X-ray. It will be MSP. So you could say lined up with the belly button. And in fact, kind of a trick of text is to find the belly button on a asthenic patient. On a asthenic patient, try and find the belly button, and it might be like an easier place to locate. That usually lines up with the iliac crest and MSP. Okay, now one of the things that a radiologist will look at right off the bat to make sure you have the kidneys, ureters, and bladder, which is what KUB stands for. One of the ways they'll make sure you have the bladder on your image is they will look for the pubic symphysis, which represents the very bottom of the pelvic cavity. Thus, you must have the bladder in there if you have that in your image. You can give a patient a pillow for their head, maybe underneath their knees, just anything to make them more comfortable. Making a patient comfortable is another way to immobilize them. A patient who's uncomfortable is more likely to move to make themselves comfortable. This time respiration, it's a lot different from the chest. You only ask them once, and you ask them to take a nice breath in. Give them some time to then let it out. Let them let their breath out, and then say, then hold it. So breath in, let it out, and then hold it out. Expiration makes the diaphragm move up, the lungs deflate, meaning that the diaphragm moves up, has more space, and then the abdominal organs are less compressed. Page number there for the X-ray, and then we can see, although we barely have the pubic symphysis on there, just barely, that's still good. We still have it, meaning that the bladder is above it. It must be up here, so we got the bladder. There's not too much to see without contrast for a KUB, except maybe kidney stones, or if anything's blaring, maybe with gas in the intestines. Maybe they have an obstruction causing a big buildup of gases in their intestines, things like that. Why we might do this. Okay, real fast, the upright abdomen is going to be very similar, but this time it's on the Wolbachie. This marker is incorrect. Do not do that. It would be correct if this was a left marker, because we can see this border here will line up with this side of the body, which is the left side of the body. So with our marker there, that would end up here on the image, which is the left lower side of the body there. But in the meantime, they're trying to show you how to set up. We find the crest again, just like we did on the KUB, but this time we go 2 inches above it for that horizontal line. And in the meantime, this line is at MSP. Now what this does by going 2 inches above the iliac crest is it includes the diaphragm. That's probably about right here. Now why do we want to include the diaphragm? On the upright one, we want to include the diaphragm to see any air fluid levels or like free air around the diaphragm. That's one of the main reasons to do it. You might have an abdomen series. Maybe it's like a 3-view acute abdomen series. If you get something like this in clinic, what you'll probably end up doing is a KUB, just normally. The upright abdomen, or the second view, will probably be done at the chest. And then the third view will be a regular, just PA chest x-ray. And those will end up being your 3 views for that series usually. Let's see what else. Here's an upright abdomen. We can see, although I don't see much free air around the diaphragm, there are a lot of air fluid levels going on. In a previous video, I asked you to imagine a water balloon, half filled with water, half air. Imagine placing it on the floor and then looking down straight at it. You wouldn't be able to tell where the water level was, but now look horizontally with the patient upright. Imagine this is your water balloon. You can very clearly see where the water level is and then where the air is. And this could be an example of an obstruction or blockage. And that's it.